Ankle fractures most commonly occur as the result of a fall or some other type of trauma to the leg. This type of injury can be very painful. The fracture patterns vary widely, and depending on the severity of the fracture, you may require surgery. Be advised, this may not always be determined on the initial visit. It is important to have very close follow-up with an orthopedic surgeon who will be able to determine if surgery is required. You may have had your ankle splinted. This will decrease any movement to the fracture and decrease the level of pain and swelling. Wear the splint until you see the orthopedic surgeon. It is also important to ice the fracture site and to keep the ankle elevated on some pillows above the level of your heart. Ice and elevation will also reduce the swelling. Apply ice several times per day for about 20 minutes for the next 2 to 3 days. If you were advised to use crutches, try not to bear any weight on your leg with the fracture. You may also have been prescribed medications for pain. If so, take the medications as directed. Prescription pain medications may make you drowsy, so avoid driving, operating heavy machinery, or drinking alcohol while taking them. If you smoke, it is important to stop, as smoking may delay bone healing. It has been determined that you can be discharged. You will need to contact the orthopedic surgeon for an urgent appointment. Contact their office as soon as possible. Sometimes ankle fractures can cause significant swelling or damage to the surrounding nerves, soft tissue, and blood vessels. No serious swelling or damage has been identified at this time. Nevertheless, you should contact the orthopedic surgeon immediately or return to the emergency department if you develop any of the following: intense pain, increased swelling, numbness or discoloration over the toes, loss of movement in the toes, fever, your condition worsens, new symptoms develop.